Welcome to Madam N. My name is Sarah Ashiki binti Azmi and this is my groupmate. We will be presenting about abdominal aortic aneurysm, which contain the introduction, signs, symptoms, abdominal findings, CT scan images in terms of transverse, sagittal, and coronary plane. And last but not least is the conclusion. Let's get started with the introduction. Aneurysm is derived from the Greek word aneurysma or widening. Abdominal aortic aneurysm, also known as AAA, is an abnormal dilatation of the infrarenal abdominal aorta of 3 cm or more. It occurs when the abdominal aortic wall weakens, causing it to bulge or balloon, resulting in permanent and progressing focal dilatation of the abdominal aorta. AAA affects 1.5% of men older than 60 years old and 1% of women of 64 years old. This pathology is the 14th leading causing of mortality in the United States, resulting in 4,500 deaths each year.
Hi and Assalamualaikum. My name is Muhammad Hisham and I am going to explain about the signs of abdominal aortic aneurysm fractures. There are several signs to look out when a AAA ruptures happen, such as the doctor may look for a lump/a mass in the abdomen resulting from the clots that pull in the abdominal aorta, causing a bulging in the abdomen areas. A stiff or a rigid abdomen also can be diagnosed through a doctor examinations. Upon examinations, a porcine mass can be felt in the abdomen just above the umbilical levels. Another signs of a AAA ruptures is a cold foot or a black/a blue painful toe. This can happen if an aneurysm produces a blood clot that break off, and the blood clot can end up clogging the blood vessels in one of the legs. Next is an extreme drop in the blood pressures that could lead to fainting, followed by a rapid heart rate, sweatings, and a feeling of clamminess.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nakarini Sabitul Rahman and I will continue with the symptom. So in many cases, an abdominal aortic aneurysm or AAA develops without any noticeable symptoms, earning it the reputation of being a silent condition. This is because smaller aneurysms often do not affect surrounding tissue or organs. However, symptoms may arise as the aneurysm grows larger, particularly when it begins to put pressure on nearby structure or organs. So the most commonly reported symptom is generally pain or discomfort in the abdominal area. This pain may come and go or it may persist as a constant ache. And this discomfort is one of the first potential signs of an abdominal aortic aneurysm. Other symptoms can include pain in the chest, abdomen, lower back or flanks, which is the area over the kidney. This pain may radiate to other areas, such as the groin, buttocks, or legs. Patients often describe the pain as a deep, itching, gnawing, or even throbbing. Interestingly, the pain is usually unaffected by movement, but may feel slightly better or worse in certain positions. Another hallmark symptom is a pulsating sensation in the abdomen, often felt near the belly button. Patients sometimes describe this as a feeling of a heartbeat in their stomach. On the other hand, when an abdominal aortic aneurysm rupture, it becomes a life-threatening emergency due to the risk of massive internal bleeding. A rupture typically presents with a sudden or severe pain in the abdomen or lower back. The pain is often described as a sharp, intense, or tearing and may radiate outwards to the other parts of the body. Additionally, symptoms of a ruptured aneurysm include shortness of breath or SOB, dizziness, and nausea. These symptoms combined with the severe pain can signal a critical condition that requires immediate medical intervention. And without a prompt treatment, a ruptured abdominal aortic aneurysm can lead to death in a matter of minutes or hours.
Hi, my name is Putri and I'm going to explain further about abnormal findings in CT scan images. But before that, let's take a look first at the normal image of aorta in the transverse plane. So, from the image shown, we can see the normal appearance of the aorta in the CT transverse plane, which is located near the diaphragm, as the aorta can be seen as a circular structure anterior to the vertebral column. The normal size of an aorta is typically about 2 cm or 1 inch. Now, let's move on to the abnormal findings image, which has been diagnosed as abdominal aortic aneurysm, or called as AAA. As the diagnosis of AAA is made when the maximum diameter of the abdominal aorta is greater than 3 cm, the image clearly shows an enlargement of the aorta, which is measured approximately around 3 cm and located quite distant from the vertebral column. However, this kind of aneurysm, in which the aorta appears smaller than 5 cm, does not pose a significant risk of rupture. When an aneurysm ruptures, it can be relatively subtle, resulting in blood leakage from the aneurysm sac, or it can be worse, which results in a large amount of blood surrounding the aorta. In the image shown, we can clearly observe a subtle ruptured AAA as a large aneurysm of the abdominal aorta measuring 8.5 cm nearly squeezed to the spleen with only subtle surrounding stranding, which indicates an early rupture. For the last image by using CT angiogram CTA, the aorta is seen very bright with the presence of contrast used in this procedure. There is a large and irregular aneurysm with extensive bleeding around the aorta, and we can even see the blood actively leaking out from the area of the rupture. This indicates a very poor prognosis for the patient, which is considered as severe case.
Hi, Assalamualaikum. My name is BINTI, and for my part, I will be explaining about the pathological finding of abnormal aortic aneurysm in sagittal plane of CT scan. This is the normal plane of abdomen in CT scan sagittal plane. Generally, the abdominal aorta is the continuation of the thoracic aorta, beginning at the level of the 12 vertebrae. It is approximately 30 cm long and ends at the level of L4, which is lumbar 4. In normal plane of abdominal aorta, there is no compressions of adjacent organs surrounding the structures. All structures are aligned and aorta size is not more than 3 cm. As we can see here in this radiograph, it consists of enlarged size of abdominal aorta and the erosions of the vertebrae. The fusiform aneurysmal dilations of the infrarenal abdominal aorta is seen, extends over a distance of 125 mm. It begins from the distal of the renal arteries and terminates at the aortic bifurcations without extensions into the iliac arteries. There is also the observations of the second and third lumbar erosion due to the extension size of the abdominal aortic aneurysms that compress the bone and the surrounding structures. Lastly, in this radiograph, there is abnormal findings and unaligned anatomic structures. The red circle shows that a smooth eccentric mural thrombus is noted within the measuring about 38 mm. These signs of thrombus restoration indicate that there is signs of impending rupture or contained leakage. The green circle shows that the prostates are enlarged, and the yellow circle shows that the fifth lumbar are lateralized. This indicates that the structures are not aligned with other surrounding structures. Together with these features, it shows that there is signs of abdominal aortic aneurysm.
Assalamualaikum, my name is Siti Fatimah Zahra binti Abdul Aziz, and now I am going to present about this first image, which is showing a coronal plane of CT angiogram abdomen with normal size abdominal aorta. The abdominal aorta is a major blood vessel that runs vertically down the center of the body and starts below the diaphragm and extends down and branches into right and left common iliac arteries. And it is located anterior to the spine and slightly to the left of the midline. Normal abdominal aorta size is approximately 2 cm, which range between 1.4 cm to 3 cm. And when the aortic diameter exceeds 3 cm, that indicates that patient may have abdominal aortic aneurysm. Next, this is another image of CT abdomen that has abnormal size of abdominal aorta. And this image is showing an enlarged abdominal aorta, where this yellow arrow is showing a very large abdominal aortic aneurysm that measures about 8 cm in diameter, which is abnormal. And it appears as a large rounded appearance that can be seen projected out from the aorta. And there is relatively subtle haziness in the image due to the slow leakage of blood products, which may indicate an early rupture of the abdominal aorta.
In conclusion, abdominal aortic aneurysm is a life-threatening condition characterized by the dilatation of the abdominal aorta. Early detection and management are critical to preventing complications such as rupture, which is associated with high mortality rates. Imaging modalities such as CT scans being the gold standard are essential for both diagnosing and tracking the illness. In CT, AAA appears as large rounded bulge that projects off from the aorta. The reported CT specificities and sensitivities vary from 97.7% to 99.2% and 65.2% to 99.2% respectively. Management focuses on timely intervention, including surgical repair or endovascular aneurysm repair, EVAR, to prevent rupture and improve patient outcomes. Awareness, screening, and prompt treatment are essential in reducing the mortality and complications associated with AAA.